Hi everyone, this is Dr. David Lee, a physical therapist at Physical Therapy and Balance Center, Germantown. I'm coming to you today with a new video. I'm calling this video the disc myth. The reason I wanted to talk about this is a lot of people who have back pain, especially chronic back pain, will come in, and when I ask them about what they think is causing their back pain, they'll say it's my disc, or I've been diagnosed with a disc herniation. So I wanted to talk about 3 myths around the discs. Number 1, a disc herniation is a terrible finding. Okay, a disc herniation simply means that the disc material has gone beyond or exceeded the disc space or the boundaries of the disc. So the disc is actually filled with water, and the material has gone a little bit beyond its borders, and so you have a herniated disc. But the prevalence of disc herniations is very high, especially as you get older. So if you're older than 40 years old, the likelihood of you having a disc herniation right now is better than 50%. And it's a very common finding. So common that most clinicians are now starting to believe that disc herniations are normal aging process. It's part of the aging spine. Just like as we age, we get wrinkles on our skin, we also get wrinkles on the inside. So a disc herniation is simply a sign that your spine is aging, and that's very, very normal. However, the likelihood that the disc being herniated is causing your low back is actually very low. Statistics show that less than 3% of low back pain is actually coming from a disc, meaning a disc does not cause back pain very often. It's a very low correlation, as we call it. The times that the disc will hurt your back is because you've actually fractured the disc away from the bone. So let me give you a model. This is the spine, and we have 5 lumbar vertebrae. Okay, we call them L1, L2, L3, L4, L5. We number them and we call them L because they stand for lumbar. So when you hear a doctor say you have herniated lumbar 4 and lumbar 5, they're basically saying you've herniated the disc between 4 and 5. So if I come around on this model, you can see there's a little herniation on this disc between 4 and 5. So that's a herniation. It's where the material of the disc has gone beyond its borders. That's actually a very common finding. However, if it's very severe, you bent over and you picked up something very heavy, you can actually fracture the disc away from the vertebrae off the bone. Okay, so it's called a vertebral end plate fracture. We fractured the disc away from the bone. And that's not very common, but when it happens, it's very severe. You can't get out of bed. You have severe leg pain. You may even have foot drop. You may have bowel and bladder problems, meaning you can't control it. That's a very significant finding. But however, it's less than 3% of all back pain cases. So it's pretty low, but when it happens, it's very significant. So if it's less than 3%, then we gotta think it's probably not the disc a lot of times that's causing low back pain. So that's number 1. Number 2, if you have a disc herniation, you can't bend over or you can't lift anything anymore. That's also false. When you have a disc herniation or injured disc, it can actually heal. And we've also found that depending on the time of day, your disc will be full of fluid and very robust, and then later in the day, your discs lose water because we're standing up against gravity. So when I'm upright, moving around, even sitting, I'm against gravity. So the discs lose some of that fluid. So if you MRI my back late in the day, you'll find that my discs are smaller. And in the morning, when you first wake up, they're fuller. Because it's a moving part of our body. The disc fluid moves in and out all the time, throughout the day. So your herniation might look differently, even in the morning versus the evening. So a finding of a disc herniation does not mean you can't lift things or you can't bend over. That's a myth. It's actually good to start to bend a little bit, and we bend properly by using the hips. And we teach that in physical therapy. It's actually very good to strengthen the back because your back muscles are very strong. It's one of the strongest muscles. But we train it properly and you can restore your back very well. It's actually good to lift, but properly in physical therapy. So that's the second myth. And then the third myth about discs is that somehow you're impaired for life. Again, disc herniations are very common, especially as we age. It's so common we're thinking that it's the aging spine, it's a normal finding, and that it's not going to limit you. It may limit you from time to time because you might get muscle spasms or you have some restriction in movement at that segment, but it doesn't limit you in what you want to do in your everyday life. You can do all the things that you want to do with the disc herniation. It's a myth to think that this is an impairment for life. I hope this helps. I hope it helps to dispel some of the myths surrounding the disc. And if you do have an MRI report that shows that you have a disc herniation, welcome to the club. I do as well. And you are totally normal and you have an aging spine that is just having some changes or wrinkles on the inside. All right, I hope to see you guys on the next video. Thank you for your attention.